submit questions. Yeah, so just click got it. And please submit questions in the chat box. So we'll have someone monitoring that. So we'll make sure that we get to as many as we can. Yeah, so we'll just move into intro for the panelists. Shane, do you mind starting that off?
I would love to. Thank you. The long years of dedicated and hard-fought activism, in particular and centrally by people who use drugs, the notion of drug decriminalization is now being discussed and in some places enacted throughout the country. While decriminalization of drugs and the ending of prohibition is a vital step in protecting our communities from the health and human rights consequences of criminalization, the contours and shapes of how decriminalization unfolds vary greatly from place to place. In BC, a 3-year decriminalization pilot will begin on January 31st, 2023. And while this event will mark a historic shift in Canadian drug policy, critics have said that it falls too short of what decriminalization is intended to accomplish. This panel will explore some of the aspects of drug decriminalization that will help us better understand what decriminalization is and it is not intended to accomplish, how the BC plan will unfold and why, how this will impact rural and remote communities, and why drug reform is a trade union issue. We are joined by panelists Caitlin Shane, Brittany Graham, Hawkfeather Peterson, and Garth Mullins. I think there are other slides with their beautiful pictures. Can I read this? Caitlin Sheen is the staff lawyer at Pivot Legal Society, a human rights legal organization based in the downtown east side of Vancouver. As Pivot's drug policy lawyer, Caitlin takes direction from drug user-led movements. She has appeared at the Supreme Court of Canada, the Federal Court of Canada, and the BC Supreme Court.
Our second panelist, Brittany Graham, MPH, is the current executive director of the Vancouver Area Network of Drug Users, also known as VANDU. With over 15 years of experience working on drug use research, policy, and advocacy, Brittany is deeply committed to ensuring the voices of people with lived experiences are heard at all levels of research, policy, and program creation.
Hawkfeather Peterson, they, them, is currently the regional peer coordinator for the Northern Health Authority. They also work as a project coordinator for PAC, Parents Advocating Collectively for Kin. They have had the privilege of working as a frontline outreach worker, running a local drug user group and sitting as an executive board member of both the federal and provincial drug user groups, the Canadian Association of People Who Use Drugs, and the BC Yukon Association of Drug War Survivors, and many other wonderful opportunities to share their voice and fight for the rights and freedom of drug users. They are the birthing parent of 6 amazing and beautiful children and a visual artist when they have the time.
Garth Mullins is a drug user activist and award-winning radio documentarian. He is host and executive producer of the Crackdown podcast, where drug users cover the drug war as war correspondents. He is a member of the Vancouver Area Network of Drug Users, VANDU, and is also a trade union organizer and musician.
Okay. Okay. Pardon me. So if we could please feature or spotlight the 4 panelists, that would be great. There we are.
This is like the Zoom version.
Caitlin, do you want to just take it away?
Yeah, I can help. Hi, everyone. My name is Caitlin Shane. I'm a staff lawyer of drug policy with Pivot Legal Society, which is a human rights organization, legal organization based in the downtown east side of Vancouver. So thanks everyone for joining today, and thanks to CDPC and BC Health Coalition for getting us all together in one room. I can assure you that my little bit that I'm going to be talking about is far less interesting than what my co-panelists are going to be talking about. But nonetheless, I think it's important that we all kind of, before beginning discussions about safe supply and decriminalization, that we get on the same page in terms of what these terms mean and what they don't mean, what they can help achieve and not, and especially what decriminalization can mean in the context of BC's recent policy development that's set to take place in January of 2023, its own decriminalization policy. So just to start things off, decriminalization refers to the removal of criminal consequences for a particular activity. The operative phrase here being criminal consequences. Because oftentimes what we see in decriminalization policies is a removal of criminal consequences for an activity replaced by administrative consequences for that same activity. So, you know, when we think about Portugal as an often cited model of decriminalization, what actually happened in that context and in many other contexts has been a replacement of criminal consequences by things like administrative fines and penalties, and people being coerced to appear before panels who then put together forcible plans for those people. Decriminalization can take the form of actual law reform. So we call that de jure decriminalization. And that would be effectively where you would have, in Canada, for instance, the federal government going into the law under the Controlled Drugs and Substances Act and actually repealing or amending the provision that prohibits drug possession. But then you can also have something called de facto decriminalization, which is more like changes in policies or practical enforcement of that offense. So even though it remains an offense on the books to possess drugs, the way that it gets enforced looks different. So for instance, police could adopt a policy of non-enforcement with respect to simple possession. In the drug policy community, typically, the term decriminalization refers to a removal of penalties for simple drug possession. So that's drug possession for one's own use, regardless of the amount. But as we more frequently engage with the concept of decriminalization, we see different people using this term differently, usually with a goal of convincing people that their version of decriminalization is the right one. So we oftentimes hear people in government saying that they advocate for decriminalization, but when we actually drill down and look at the policy that they're talking about, it can oftentimes not actually be full decriminalization, be something like partial decriminalization, which is very much what we saw in Portugal. You had a government saying, yes, we've decriminalized, and yet people are still facing penalties. And people are still experiencing criminalization of a type for possessing drugs. So when we talk about decriminalization, and when I say we, I mean myself and my comrades in the drug policy community who are advocating for change, will typically be using it to indicate a model where possession of any amount is decriminalized and is not met with any sanction whatsoever. I know a lot of us also advocate for the decriminalization of drug sharing and street-based drug trafficking, but that's usually not what is meant when people are talking about drug decriminalization. It's usually just possession of drugs for personal use. What is decriminalization good for? I think in addressing this question, it's good to start off by talking about what decriminalization is not good for. You hear government saying a lot that decrim is not a silver bullet. And that's true. It's not a panacea for a toxic drug supply. It's not going to fix the violence and brutality that police use to enforce drug policy, like criminalization of drug possession. Decriminalization is not safe supply. The fact that people who use drugs will no longer be criminally charged for possessing certain amounts of drugs does not mean that overnight we'll have access to a supply of regulated prescription grade substances. But in spite of these shortcomings, that doesn't mean it's not worth fighting for or implementing. The fact that decriminalization is not a silver bullet cannot be a reason or justification to throw in the towel and say, well, then it's not worth doing. Of course, there's no single thing that's going to fix everything, but we need to take steps, and this is one of the steps. And what decriminalization really is at its core is very basic harm reduction. It is a policy aimed at reducing the harm caused by prohibition and caused by the police and law enforcement people who enforce prohibition. So there's ample evidence that when drug possession is criminalized, the activity gets driven underground, and that comes with tremendous health and safety consequences. On the one hand, we have government encouraging people every day to access overdose prevention sites and supervised consumption sites, at the same time providing no legal protections to people who want to travel from their home to one of those sites with drug in hand. It's an incredibly contradictory message that government is sending people. There's this whole talk of public health, it's not a criminal issue, and yet we criminalize people every day. And particularly poor and racialized people who use drugs. Okay, I think I only have a few minutes left, but I will talk about BC's policy of decriminalization. So this year, as many of you may have heard, the province applied to the federal government, to Health Canada, to decriminalize drug possession by way of an exemption. Under the Controlled Drugs and Substances Act, the Minister of Health, the federal Minister of Health, has the power to exempt any person or group of people from any provision under the Controlled Drugs and Substances Act. So BC effectively said, hey, Health Canada, can you decriminalize all adults in BC so that the prohibition on simple drug possession does not apply? And Health Canada said, yes, there are conditions, but that policy is set to take effect, I believe, end of January 2023, and it's a 3-year pilot project. So as I mentioned earlier, the term decriminalization gets used differently by different groups of people. I would argue, and I suspect many of my co-panelists would argue, that what BC is implementing is not real decriminalization. It's not full decriminalization. And its conditions or limitations are very restrictive and are going to have serious impacts for a lot of people who use drugs. So I'll tell you a bit about the policy, what it looks like. The policy applies to people aged 18 and over. So that means that youth will not be protected by this new policy. They will remain criminalized for possessing drugs under the Youth Criminal Justice Act. So that's obviously an issue because youth use drugs, youth are at risk of overdose, youth deserve all of the protections that decriminalization affords, and yet they're being left out of this policy. Very importantly, this policy only protects against criminalization for possessing drugs up to a quantity of 2.5 grams total. If you possess more than 2.5 grams total, the regular criminal prohibition on drug possession still applies. it's only under 2.5 grams. It can be a mix of different types of drugs, but total quantity can only be up to 2.5 grams. And as we're going to talk about a little bit later on this panel, that threshold quantity that distinguishes between criminalization and non-criminalization is very low. It might be enough to protect a certain group of people who use drugs, but for a variety of reasons, people possess more than 2.5 grams at a given time, especially people who do not have the luxury of a home or storage in which to keep their drugs, people who live in rural and remote communities who don't have super regular access to their dealers, people who possess and buy more than 2.5 grams of drugs at any given time. So there's a lot of reasons for it, and this policy won't protect them. And if we think of decriminalization as a policy that is meant to extend benefits and protections to people who are most harmed by criminalization, this policy misses the mark because it's leaving out an entire class of people who use drugs who need the benefits of decriminalization. Under this policy, trafficking is still going to be illegal, although it has made some concessions for drug splitting and sharing where there's no profit motive. So we'll see how that plays out. But I see that as being a good thing. And then it'll be determined still what the limits are of this policy in terms of location. Where can you possess drugs in public or not? And as is particularly relevant for today's conversation, what drug possession in the workplace is going to look like. So the exemption letter from Health Canada is relatively silent on employment policies in relation to decriminalization. All that is said is that the Ministry of Mental Health and Addictions will work with employers to establish appropriate drug policies in the workplace. You know, the fact of certain drugs being decriminalized does not automatically clear the way for drug possession to be decriminalized in the workplace. If you think about alcohol, which is legally regulated in Canada and elsewhere, that doesn't mean that you can drink on the job. So there can still be workplace policies that will likely take effect beginning in January along these lines. Arguably, harm reduction should be a conversation in the workplace to ensure legal responsibilities on both sides of employers and employees. Okay, I'm going to stop talking because I feel like I've been going for a while, but happy to answer any questions later. Thanks.
Hi, I'm Brittany. I think Shane did my introduction earlier. Sorry, I turned off my alarm, so I'm a little off of it today. But so my name is Brittany. I'm currently the executive director of the Vancouver Area Network of Drug Users, but I've worked at Vandu for over 10 years and in drug policy for even longer than that. And so the context that I'm supposed to be giving today is sort of the processes around how decrim has been established in BC and the process of Vandu being a part of that or being excluded, and how it kind of relates to the thresholds that Caitlin just mentioned and how they're not really based in anything specifically around the research and even evidence we've found from folks in community. So I appreciate Caitlin speaking about like the context of decrim. I think it's really helpful for us to like understand where we're standing and what the point of this policy that's coming in on January 31st, not January 1st, if people thought it was January 1st. So the way that Vandu kind of got involved in this process was actually with the exemption request that came from the city of Vancouver about 5 months prior to the request that was being put in by the province. So the city of Vancouver, they actually came to Vandu to our board with a fairly solid document that they already wanted to present to the exemption team. There wasn't a ton of consultation with community at that point, and there was some at the beginning through like a mayor's council, but they came to the Vandu board with research from the VITUS study, which is one of the longest studies in the world reviewing injection drugs. So it's Vancouver injection drug user study. So they had numbers from that based off of people's experiences for, I think, over 10 years related to the amount of drugs they used and the amount of drugs that they would have on them, et cetera. And so from that, there was a scale that was created. When we read the actual document that we were provided with, the scale in which people could, what they recommended, so a small amount of drugs to a larger amount of drugs, this should be on the threshold of decrim. The actual recommendation from the city was significantly lower than the actual scale of research that they were presenting. So I'm not sure if people remember the city's numbers, but they were much smaller and they were per drug. And so it was fentanyl or heroin, people could have 2 grams per drug. Cocaine was 3 grams, a crack was 1, and crystal meth was 1.5. And when this was brought to the Vandu board, immediately there was a lot of anger that came from our board members. At the time, it was during COVID, so through a computer screen to the city staff about how it wouldn't reflect their current drug use. In that room, I heard one of our board members say, I have 2.5 grams of, or I have 3 grams of drugs before breakfast to come here for this board meeting. And he's his normal self, he's his normal way of being. There's no difference in the way that he acts to the way that I would know him, and him being able to be a competent board member. And so like in that exact moment, we're recognizing as a board that there's a huge discrepancy in what this group is seeing related to the research, showing that there should be higher thresholds, and even anecdotally about what people who use drugs are using on a daily basis and would be beneficial to their lives. And even the sort of perception of what the amount of drugs people can have in their system and, you know, carry on working and, you know, having families and all of that stuff. So at that time, we made the decision to get deeply involved in decrim because we were very concerned about the direction that the city was going. There was a lot of activism and education that came in the coming weeks. One of the things that came from that is us deciding to do a very quick survey with our members about purchasing and possession, because those questions were not very good on the VITUS survey that they've had for 10 years. That it's like possession is just not something that they have asked specifically about, or purchasing patterns. And so we worked with a researcher that we have worked with for decades, Thomas Kerr and his team, and discussed the kinds of gaps in research and discussed the questions that we feel will be important at Vandu, as well as the things that might have been missed by the city, and decided to come up with a very short survey. And we brought that to our community very quickly, had community members do the actual data collection in the streets of the downtown east side, and then had that analysis done by Thomas's folks. So we ended up with 162 surveys that were completed and to the standards of like a general survey. And I think the things that we found that were very interesting is that in that most people were smoking. So there was 91% of people smoking, and that the average amount of drugs that people were, like the average number of people were buying drugs for was 2 other people than themselves. So when people are purchasing drugs, they're not just buying them for themselves, they're usually buying them for other people. When we've asked follow-up questions of folks afterwards, not a part of the study, usually people are citing, there's somebody on my floor who can't get out of the building. It's mostly stairs or elevators broken, and so I usually purchase for them. Or I have a friend who's feels vulnerable for whatever reason, older, might be a female, whatever, and they don't like to engage with dealers, so I purchase for them. So there's usually like reasons as to why people are purchasing for other people. And so those are like really important things to think about. Beyond that, I think the big thing to note here is that the way that people are using drugs now is much higher than I think in the past. So one of the questions was like, how long would 2 grams of opioids last you? Because that was the threshold that was being proposed by the city. And in the survey, the average answer was 24, 25 minutes. So the toxicity of these drugs are also increasing people's use, where like you get higher quicker, but that come down is quicker. And so people are using drugs more frequently, where if you ask people a few years ago about opioids, if it was specifically like heroin, it probably would have lasted significantly longer than half an hour. And so when we're thinking about possession in that terms, if people can only have 2 grams, that means like multiple times in the day, a person would need to go source their drugs to remain in the legal limit, which then affects things like being able to be at your job at the right amount of time, to see your family, pick up your kids, all that sort of stuff. And so these legal sides of things, when we're only thinking about the drugs and we're not thinking about the people who are actually using them, can be very harmful in that execution of the policy. And then lastly, I just would like to mention that like as we moved into the next phase, I think Garth's going to be doing more conversation about the next phase more. As we moved into the BC government one, once it was put into, so the city didn't really listen to us. We did a lot of advocacy and a lot of pushing, but their stance was at the time, Health Canada will not approve an exemption request unless the police are on board, because it is a criminal system and the police need to be a part of that, et cetera, is their reasoning. So the police had a very specific idea of how they wanted the thresholds to look. And that is why in the original proposal from that we got at the board meeting, the numbers didn't match the actual research. And in the end, when we presented our own research to show how much people were using, for example, like the typical amount that people purchase on a day, the most that they would purchase on a usual day was like 5 grams of heroin, but a usual purchase would be like 3.5, which is usually like a speedball or goofball or something like that. Those informations didn't change the city's application because they were pretty set on working with the police and doing what the police thought was important so that they could get the exemption actually through Health Canada. And I would say that same mentality, maybe not to the same extent, did transfer into the Ministry of Mental Health and Addictions exemption process that happened a couple months later. There was a strong police presence on all of the committee groups. The numbers that we came up with as a group for the threshold were closer to 18 grams. And then when it was brought to different political areas of the BC government, it was brought back to our committee at 4.5. And we believe that that was because there was a lot of safety and security folks who were lobbying for a lower amount. When that exemption request was sent to the actual Health Canada a team who does exemption requests, it was at 4.5 grams cumulative. And when it returned to BC as approved, it was at 2.5 grams cumulative. So those numbers are numbers, and they're the numbers that you will see as public, and our entire community in BC will see, but they actually don't reflect the research. They don't reflect the experience of people who use drugs, and actually could be really harmful to a large population of people. And even 2.5 is a weird number, as I previously mentioned. Like the usual amount that people would buy in a day was 3.5 grams, and that's because that's like a standard measurement for folks in the community who use drugs and the people who sell those drugs. So to use a 2.5, where the police wouldn't be able to recognize that, the people who are buying drugs are not even using that, is actually not reflective of the actual system we're in currently, and will make more work for police officers and for community members. But ultimately, the police can go to the federal government and say, we need more money to educate our folks so that they understand this number, where the people who are buying drugs will just be criminalized in a way that they weren't criminalized before. And so that inequity just continues to grow. I realize I've been talking a lot, and there's a lot that I probably didn't go over, so I'll wait for questions.
Hi everyone, I'm Hawkfeather Peterson, and my pronouns are they, them. And I'm here to a little bit to talk about drug use and bodily autonomy. It's a bit of a, pardon the backlighting too, but I'm in a hotel. It's a bit of a abstract topic to some people. It isn't to me. I feel like it's often actually a really fundamental aspect of these dialogues that gets very neglected. And I think if we're talking about policy creation and implementation and the larger concept of the drug war, our sort of right to exist as drug users gets a little bit pushed by the wayside as a vital part of the discussion. And I know that I often to people communicate that I'm a substance user. And for me, that is an aspect of who I am as a person. It's not something I've ever felt ashamed of. It's not something I've ever, felt was a negative aspect of who I am. But that is contradictory to what I'm told from the exterior world about who I am. And I think that, when it comes to stigma and internalized stigma and a lot of people's views and ideology around substance use, there's this sort of, to me, there's this elephant in the room that, our charter rights, our basic human rights are supposed to defend who we are and our right to be, governing our bodies and making healthcare decisions and social decisions about what impacts our bodies, as long as we're not harming others, as long as we're not harming society. And I feel like this topic has been very confused over the years about what harm is being done and where the harm lies. A lot of the harms that get associated with substance use are directly because we're criminalized. And we know that very plainly, but it's just not something that really gets relayed to the general public. And I find it's often something that even healthcare providers aren't necessarily conscious of or cognizant of when I'm speaking to them about the fact that all the negatives, the survival crime, the things people will, throw off as a dig quickly about drug users, that they're all thieves, that they can't prioritize anything but their drug use, that all the stereotypes, while some of them might register as true at a simple, uneducated look, most of them are related to being criminalized. And when those things start penetrating your sense of self and your sense of self-worth, it really just breaks a part of you. I don't know, it's kind of hard to describe, but I feel so strongly that we need to start unpacking and picking apart people's basic understanding of what it means to be a drug user. And, you know, we often have these panels we present about the history of drug laws to try to point out that they were just basic bullshit racism. They weren't evidence-based, they're not medically sound. Yet here we have this massive industry wrapped up in basically mythology. I don't know, for lack of a better way to put it. Because when you actually look at a person and when you actually give them the freedom to speak freely, a lot of the time, you'll find that if I don't want to lump substance users together, so a lot of the time, I'll talk to folks and I'll talk to them about their substance use, and before they know anything about me or who I am or my belief system, they'll tell me, "Oh, I'm a substance user, but I'm this much clean. I've been clean this long." And as the conversation sort of organically develops, we come to a point where I share that I don't have any judgment about substance use, that I find it a beneficial aspect of who I am, that I'm grateful for it in my world, in my life. And then when they're given the freedom to share openly without that forced expectation of, you know, abstinence or striving for abstinence, they usually share with me that they're, you know, that they're not abstinent or clean, as the language often is, but they just felt obligated to toe that line, because that's what the expectation is. And I often say, as an activist, the most, for lack of a better term, the most radical thing I can do as an activist is, I don't know, exist. like exist and be open about the fact that I'm a substance user, because that's what I'm told I'm not supposed to do. I'm supposed to be ashamed. I'm supposed to be very apologetic to the rest of the world. I'm supposed to, I don't know, be filled with self-hatred and self-doubt. And when I'm not, it really confuses people sometimes. But just to, I know I'm kind of, this is sort of abstract stuff, but it isn't. It's our basic right to exist, to be treated with dignity, to access healthcare services, eat with equity, to make decisions governing our body, what we put into our body, what medicine is available to us. We're equally able to seek well-being and self-care. And for us, sometimes that means substances that just happen to be illicit and criminalized. And I really feel pretty strongly that there's some biases that I'm hoping that a lot of healthcare professionals and service providers will really explore about substance use and what really they think they're battling. What is the war on drugs really battling? Are we trying to, you know, prevent overdose anymore? Or are we trying to prevent substance users from existing? What are we combating here? And, you know, if you really want to unpack something, start with what's so wrong with drug use. Because if you really want to explore the healthcare and the way substance use impacts our bodies, you really have to pick it apart from the harms that come with being hated in the world and being criminalized, being alienated and othered. And if you pick apart all of those negatives and you really try to disassociate all the harms that come with being criminalized from the actual impact of substances on our bodies, you know, it ain't the drugs, it's the problem here. And I really think that that's a real fundamental point that needs to be explored when we're looking at changing policies. It should be about our bodies and our well-being. And if we're really wanting to ensure that substance users are well and whole in the world, it might mean letting go of some of these old, outdated misconceptions about substance use. And yeah, really allowing us to have autonomy of our bodies and really allowing us to have the same rights and freedoms of other Canadians, and allowing us to make the decisions about what we need to thrive in the world. So yeah, mostly it's a topic that I could talk for hours about, but I won't. But I'm really hoping that it's a topic that people will explore on their own, and really try to look at their biases and really try to separate evidence-based knowledge and stereotypes and negative associations related to drug use and drug users. And yeah, that's me. So thank you. And I'm looking forward to some of the group questions and some of the greater dialogue. So thank you.
Hey, everybody. My name's Garth Mullins. I've been a drug user for a long time. I'm an old school dope fiend, mostly heroin, which doesn't exist anymore in a significant way. And I've been a member of the Vancouver area network of drug users for a long time and active more in the last decade. Yeah, the first meeting on decrim I went to was in August of 1998. And by decriminalization, we meant, no more cops, no more jails, no more courts, and no more of the sort of tentacles of criminalization which reach out into our lives, into like the Ministry of Child and Family Development coming to snatch people's kids away, or reaching into the workplace so that we get fired or disciplined, or otherwise have our lives directed by the consequences of criminalization when bosses stand in for cops. And I have seen this certainly as a drug user. I worked in mining, where it was a dry camp on the Arctic Circle. You go up there. I worked 6-week contracts at a time. Lots of people work 2-week contracts, but you'd have to have nothing, no booze, no nothing. So of course, people smuggled up coke and whatever else. I've seen this in the construction industry. I worked in that. And there was like just always up and down on every building site that I worked at. And lots of people would go and score before work, and still do early in the morning on the downtown east side. And those places meant that we used there secretly, alone, knowing that we could get fired, risking sanction at work, risking having our lives torn apart, and risking death, because when you use alone, it's more dangerous. And I've also been a shop steward and a local president for my union. I served 5 terms as a local president. I've been a shop steward for maybe a decade, and done a lot of like solidarity work with other unions. But I've seen members of my union sort of driven out of the working class by criminalization as it's practiced at work. So part of what I wanted to say today was that we got to end the drug war on the shop floor. And I say that to you all because I know that there's many trade union activists among our ranks here today, and that this is an issue. Criminalization of drug users and the massive overdose fatalities we see in Canada and North America. This is a working class issue. This is a labor issue. Just about everybody at Vandu was, like a trade worker or a white collar worker, had some kind of job, worked in, maybe food services or whatever. On the editorial board of Crackdown, the podcast I make, we've got people who've worked in coffee shops as stone workers, electricians, Grip from the movie industry, an editorial board's partner, worked in the oil patch as a pipeline weld inspector. If you go through Vandu and ask people what kind of work they did, there's a huge range of things. And people, a lot of people don't do that work anymore. And that's down to the drug war. That's down to people being criminalized right out of the workplace, or because of criminalization, unable to organize their life in a way that allows people to go to work. And that's so fundamental to whether you're absolutely fucking dirt poor or not, whether you can work. Those are the narrow bandwidth of choices we often have in the society, that I think that the Canadian labor movement ought to stand up for drug users, because we are you. Drug users are union members. And I want to tell you about a union conference I went to talk about decriminalization just in the last couple months. It was great. Really good comrades, people who are leading union locals, so like local presidents, rank and file activists, shop stewards, all those kind of people getting together and talking about what they want to do over a few days. And all these folks had just been come off where their comrades were on strike and actually managed to win some concessions. So there's a pretty good feeling in the room, and people were like ready to hear the message. They were ready to be like, all right, let's go help the poor drug users. We understand that as trade unionists, we want to help everybody in society, not just ourselves. That's the tradition of the labor movement. That's the best traditions that we should reach for. But there was less recognition that there were drug users in the room amongst us. And during the break, one local president came up, or one local shop steward came up to me and said, oh yeah, I've used heroin for a long time, and methadone and this and that while at work, and really tried to navigate all that. And somebody else said, oh yeah, I went through recovery and 12-step. And we soon realized that drug users aren't people out there outside of the labor movement. They are us. And not just in like day labor construction, as you might see on TV or something like that, but everywhere. I guarantee you that in every big workplace, in every industry, there's people who are criminalized drug users and just trying to hide it and keep it quiet. And of course, the consequences for being open about your drug use are so dire that you get disciplined or shit canned, or maybe you get sent to like an abstinence-based, non-evidence-based recovery house. And these are generally private, often for profit, not regulated by the state operations, where there's nobody checking in to see what are they doing for the drug user, right? So, you might get sent to some place like with equine therapy, which is like petting horses and that. And like, don't get me wrong, I do like horses, but I'm not sure whether a horse can help me kick dope or whatever, so like sign me up, let me go horseback riding. But I just don't think if your employer forces you into these places. Also, you might be on the hook for paying out to to cover off getting urine screened forever to see that you're in compliance with your sobriety, which has been told to you by your workplace. Now, the thing to remember about this is that we want to keep people alive. And these abstinence-based, unregulated places, some of the most dangerous times for us as drug users are the couple of weeks or a couple of months after we get discharged from one of those places, right? Because quitting just ain't all that easy. Your tolerance does change. You might use, and statistics have shown there's a much higher chance of fatal overdose in those periods. So we need to get the criminalization off of the streets, but also out of the workplaces. And that means we need contracts that are no longer targeting employees who use drugs, who are no longer punishing people, firing people, whatever. In more unionized workplaces, it's not as easy to just fire somebody because you caught them using drugs, but you can sure make their life difficult, and you could sure drive them slowly but surely out of the workplace. But as we know, most workplaces in Canada are not unionized. So the organized working class, the labor movement of Canada, needs to play this kind of leading role in this thing that is killing workers, killing people in the working class at a huge rate, 21 per day. so I think that recognition of how criminalization operates in the workplace is really critical. That's why I'm here today. I understand it as somebody who's been a shop steward and seen and helped my own members in my own union who are in this situation, and as a drug user who's part of the Vancouver area network of drug users. And I have sat on government committees along with Brittany and Caitlin for the past year and a half, fighting for the best possible version of decriminalization. And as we all know, in the labor movement and the social justice movement, when you fight with government, if you do win it all, if you get anything, it's often a watered down compromise. And that's sometimes how we move things forward. Of course, I don't stop, at a watered down compromise, and neither does Vandu. You keep fighting. But that's what the decriminalization that's coming here in January is going to be. We need to fight to make sure it's measured by less cops, less arrests, less interaction with the criminal justice system from drug users, all of that sort of stuff. Because government officials and cops want to measure it in like, are there less people on drugs? Are there more people going to get some kind of help or something like that? And that's all, sure, that's all very nice, but it has nothing to do with decriminalization. It's a different tool. And you also will hear this afternoon when we talk about safe supply, the decriminalization does not necessarily stop the deaths. It will have some effect, but it's not going to be this big solution that maybe some people want to say it is. That being said, it's really important. Being criminalized, getting arrested, this changes your life. When I was 19, I got arrested and charged for possession of meth in California, and I went to a very big industrial American prison in the height of the drug war, where everybody was in there for meth and rock and stuff like that. I was just with, in this pod. It was meant for 16 guys, and there were 27 of us in there. And we would spend every day just queuing for court or queuing for food or waiting or whatever. And it was just this overcrowded factory with wings spreading out into the agricultural farmland of California, and spreading across the whole state and across the US and Canada. And it was just like, it was phenomenally eye-opening to me to see that I was in this huge institution with a bunch of people who use drugs. And it was also terrifying. I was young, I can't see very well. So like I got by, if you can tell a good story and you figure out how to trade food, you do okay. But it just shouldn't be how people experience the world. We shouldn't make that a formative issue for hundreds of thousands of people in Canada and millions, I guess, across the US in total. So decriminalize now, and decriminalize on the shop floor in the workplace. We got to understand how criminalization functions on the shop floor and recognize that fighting against the drug war and ending it is a challenge for not only drug users, but for the working class and the labor movement of Canada. So thanks very much. Stay safe. Keep six.
Thank you very much. That was all of our panelists. That was really lovely. I think we're going to get you all back up here, sharing a screen, getting a few questions before our break. If so, my colleague Bita will be monitoring the chat. If you would, I'd like to ask a question, but would prefer not to speak it. We will capture that in the chat and ask it for you. But of course, if you would like to ask anything of our panelists, you can unmute yourself and ask. You can put up your hand. You can kind of wave. Get out of this view, get into a gallery view here. Any questions for our panelists? Well, we are, of course, going to get into some small groups and really dig into this, but anything that pops up for people. Maybe this is yeah, please. Tiffany, take it away. Do we need to unmute?
There we go. Can you guys hear
There we
me
go.
now?
Totally.
I'm just wondering, just future, I think we have a lot of unit activists on this chat right now, but if this is something we should look into leading into writing some type of safeties into our collective agreements for
Yeah,
drug users.
I completely agree. I think collective agreements are one of the strongest weapons to defend people, to defend workers. I would love to see collective agreements all over Canada start to reflect this sort of thing. I know that the BCGEU is bringing 3 motions, one from Component 8 and 2 from Component 6 to the BC Federation of Labor conference that's coming up this fall. And I think a good place to start would be for people who are delegates to that to go and line up at the mic and speak in favor and get this is, for those who don't know, BC Federation of Labor is the big umbrella that contains most of the unions in British Columbia, and to have them agree to lead and fund and organize the fight, maybe even start to write up some sample language for collective agreements, get their policy analysts and legal people to start looking at that. I think that's a great idea. I'm all for it.
Thank you.
What else? I'm curious. Please, Sheila.
There's a question in the chat too.
Oh, is there? Oh, wonderful.
I think it's directed at my comments, so I can.
Oh, okay. Maybe, Beta, what would feel best to you? Do you feel like okay reading out a thing?
Sure, I can read out the question.
Wait.
So hearing about how the decrim volume is happening, I found really interesting. And as you say, it's not really evidence-based. Where are they coming up with the numbers for what's okay as decrim versus not?
Good question.
Yeah, I think so if you look at, there's a position paper from the Chiefs of Police of BC. They speak about a lot of the evidence related to our project, but then twist it to fit their 1 gram request is what they were pushing for. And I think the things that they're citing is their own arrest records. So typically the amount that people would be in possession of when they are arresting people or detaining people who might not actually get the simple possession charge. They say it's around 1 gram. Obviously, this is specific evidence where a lot of people so this is what we said, Garth and I had a meeting with the minister at the federal level. And when she brought this up, we said, people who use drugs are not dumb. When people carry more drugs on them, they're not going to break the rules that they're usually pulled in for. So jaywalking or solicitation or whatever it is. So, the numbers that they're citing are based off of very specific situations. So they actually don't have a very good understanding of how much people carry or possess or purchase. It's just based off of what the police cited, and they overvalued that information in this process.
Thank you, Brittany. Any of the other panelists I'd like to speak to that as well? Please, Caitlin.
I'll just say one thing. So this core planning table was comprised of a whole host of drug user-led groups, health committees, health authorities, blah, blah, blah. And police were on that table as well. There was representatives from RCMP, VPD, and I think Abbotsford PD. Anyway, one of the incredible things that did happen in the course of this advocacy was we successfully built kind of a coalition among people on that core planning table to support a threshold quantity that reflected actual patterns of drug use and purchase, and that was determined by people who use drugs. The only people on that core planning table that disagreed with that idea were the police. So I think there was probably about 20 different parties on that table, and it was all of us against the police in terms of where we sat on this issue. And the fact that what we ultimately got is 2.5 grams, which is way lower than what we asked for, is really indicative to me in terms of the power that police had on that table, despite the fact that they were far outnumbered, and that their number was entirely unevidence-based. Like they wanted 1 gram and we were like, where did you get that? And we still don't have an answer. And now we have 2.5 grams and same answer. There's no real evidence basis, but I believe it was influenced by police significantly.
Yeah, I mean, at that table that we, Caitlin and Britt and I sat at that thing for a year and a half, and the government, using all the polite and cagey language, tried to sort of stampede people along to a more police-based idea of decriminalization. But our presence there made sure that they couldn't actually get the 1 gram that they wanted. 2.5 is still not enough, but it would have been worse. And the police were also talking about things like they'd prefer mandatory treatment and this and that. So like we could have come up with something even worse. You know what I mean? Like had we not been there. So it's like, but it's always going to be like this, right? It's like the fight for needle distribution, the fight for safe injection sites, all of those things required activism, required also going into these committee rooms, required arm twisting, and wound up with shitty compromises that required us to continue fighting afterwards. So this is like almost to be expected. And we have to keep pushing. We have to keep arguing for a higher threshold and a better version.
Thank you.
I kind of think that the question to me, if I think the question why 2.5, to me, the real question is, where the fuck are the cops at the table? Why are they even participating in a dialogue where the subject is literally decriminalization? Let alone leading the dialogue and having this much power and control. That's baffling to me why they're even there.
And I think that's a really good point, Hawkfeather, to like bring up to people here who are part of other trade unions or other unions, is that the police being a part of these discussions, they are basically acting as a union rep in those conversations. Their jobs are about criminalizing people. Most of their jobs are about criminalizing drugs. And so when they're in the conversation talking about the changing of that policy, they're actually thinking about the changing of their job descriptions and not about the people who would be getting those crimes put towards them. And so I think we have to keep reminding people of that. I think it's something that folks are not thinking about outside of our own community. And we just need other folks outside of the drug policy coalition and drug policy world to say, hey, like, why are the police in this conversation? They should not be leading it. They don't do research on this, and they actually don't share their information. Like, I haven't seen any of their numbers specifically related to this. They have some old ones on the VPD website related to simple possession, but they, like, as Caitlin stated earlier, they've had de facto decrim in Vancouver for a long time, where they actually don't arrest a lot of people on simple possession, but they do detain a lot of people, and that information hasn't been provided. And so it's, where is their information coming from? Why are they in the room? What is their motivation? And their motivation is to keep their jobs and to continue working. And we're saying the criminal system does not make sense as it is now. And why are they there?
Yeah. So let's talk about police unions for just 1 second. Management. Police management executives, the top layer of cops were at this. And that's what we've heard. We've heard about decriminalization from police management, right? From the people who run police forces, from the Association of Police Chiefs of Canada and the Association of Police Chiefs of BC. These are all management, the police bosses. The police union, RCMP, has only recently been allowed to even consider such a thing. In Vancouver, the police union is headed by this guy, Ralph Kaisers, who's incredibly reactionary and is against decriminalization. So the police unions, you should be aware, are like even more to the right generally than the police management. And we didn't see any police unions in this mix. And then finally, like, I'm an old school labor militant that does not consider police officers to be part of the traditional working class or police unions to be part of the union movement. And I know that's sometimes a controversial thing, but police have been formed for very bad reasons. Modern policing has been formed for very bad reasons, including to break strikes. That continues to be what police often do. And so I think in the House of Labor, police unions are a different thing. So like I think when we think about the role of unions in fighting the drug war, police unions are out somewhere being pro drug war. But I agree with what Brittany said, is that police being at these tables to begin with are an incredible conflict of interest, because so much of their budget comes from fighting the drug war. The cops in Vancouver's budget has ballooned over the past decades. And a big part of that has been so that they can fight the drug war or build some kind of like hazmat room to manage fentanyl or whatever bullshit, But this is something to keep in mind, is that police unions, although they aren't at these tables, they are very vocal, and they'll get on the radio and they'll say all of the things, the nasty things out loud that police bosses only say to cocktail parties at each other. So that's something to watch for. If you're ever in one of these spaces, the police themselves will say some very sort of liberal, mushy, good sounding things. Oh, we like drug users, like that sort of thing. Some of them do say that, and they're learning to speak a more progressive language, as many people have been, and they understand that that's sort of a more effective way. But the very first thing we do when we sit in these meetings is object to the presence of police and say they're in a conflict of interest here, that they are the criminalizers. And it's weird for them to be in a decriminalization process, but these aren't our tables. And we don't get to choose who sits at them. We only get to choose when we sit at them, and we get a mandate from the board of Vandu. And when we're outside of that mandate, we walk. We just say, that's it, we're leaving. And we have done that before. To the city's decriminalization table, we just walked.
So just a quick check-in around time. And I noticed that there are two hands up that I would really love to get to. And there's a question in the chat. Our schedule has us at a break right now, and that would end in about 10 minutes. So we're just going to kind of shift everything down a bit so we can get some of this conversation occurring, and then we'll just adjust accordingly. So just know that the latter part of the event may be a little squishy. Sheila, please, you've had your hand up for a while. Did you want to ask anything or say something?
Yeah, thank you very much. I'm Sheila Moyer, and I am the Health and Safety Director at the BC Federation of Labor. So the comments this morning from the fabulous panelists, and thank you very much, really resonate with me as a labor activist. I come out of the BCGEU originally, and my job at the Federation now is to deal with all things to do with occupational health and safety. So Garth's description that bosses substitute for cops, so does the WCB. And I just want to make a really quick comment around the role that the WCB plays for workers who are injured. And really the original agreement was that workers who are injured at work, suffer an injury, should be appropriately compensated. And the idea was that workers were to be able to resume their good jobs. And that often does not happen anymore. We had huge changes to the WCB by the Liberals in the early 2000s, which just decimated the system, took money out of the pockets of injured workers that has never been returned. We're running our Injured Workers campaign right now to strongly urge government to make changes to legislation that will make the system worker-centered again, which was the intent way back in 1917. So just want to add that piece to what workers experience when they're injured at work and the role that the WCB has to play, which sometimes can be helpful. But if you have a more complex case, particularly if you end up suffering from chronic pain, they don't want to hear it, they don't want to deal with you. And so workers often go from having very productive jobs, very well-paying jobs, to living in poverty, losing their families, losing their homes. Anyway, I'm just getting started. I'm on a bit of a roll. So just make a comment. And thanks to the great panelists. I've learned so much in the short time we've been here today. So thank you.
Thanks, Sheila. Is there any,
Thanks, Sheila.
does BC Fed have like a one pager on this or like a little resource that we could learn more, put in the chat or something?
Yeah, I can put something together for sure. I don't have anything here. We aren't, I think the labor movement, as you've said, Gord, we need to support workers on the decriminalization. And I think we're kind of remiss at not doing that more vigorously.
Well, thanks. That's definitely like a good thing for me. I'm going to go look this up and learn more. Thank you.
Gary.
Oh yeah, cheers. Thank you for the opportunity to speak. Just a question for Garth. Appreciate the rallying call. In terms of advocating for workers, I'm aware of like the employer and the union responsibility for duty to inquire, and to seek information into like a worker's situation. And I'm just wondering, Garth, if you have any ideas on how to support workers on a one-to-one basis.
Yeah, I mean, it's tough, right? Like I've had a little experience at this myself. There's so much stigma in the workplace and for good reason. Like, people worried about getting sidelined or shit canned or the punitive measures that I've mentioned before. So they're like just afraid to disclose, right? So people just try to pack up and manage it themselves, and that creates more danger. So sometimes I've just recommended, hey, like go get yourself on a methadone program and just keep it outside of the of the employer's sight line. I really think that one-on-one we're probably best placed for them to know their local shop steward, to know who can help them from the union, so that when the employer does bring the boom down or something happens, they can right away turn to someone that they kind of know and hopefully trust and say, come to this meeting with me. I'm worried about getting disciplinary measures used against me or something like that. And things always go better for you if you have a shop steward, like a capable shop steward with you, So we do that in Vandu, when people are having trouble with their doctor who's prescribing them methadone or something like that, we'll send one of us with them to kind of act as a shop steward in these situations where the doctor acts like the boss who's acting like a cop. But, without the systemic change that's needed around the workplace and in the collective agreements, it's hard to get a better beat on that. I know that also that as a union movement, we have to think about all the other economic considerations and production considerations that go into someone's job. Like if someone isn't getting paid enough that they have to take 3 jobs, they might be using stimulants just to keep up at that pace. If somebody's working poorly regulated or ununionized construction and they're putting up a building faster than most people can work, they might have to use stimulants there too. And then when you get injured at work and you get enough pain meds for just a little while, but then the doctor cuts you off, then you might be using illicit opioids to manage that. And that puts you in a bad place too. And that goes back to the WCB that Sheila was talking about. Right. I think some of those broader economic considerations, like basically we're just working people too hard in Canada. That's one of the big uses, the big drivers, I think, is that people are working too hard and they're having to use substances just to keep up or take the edge off that. People always do. People in British Columbia who've worked in the trades and the resource sector have always partied on the weekends. My family was in forestry and all that. And it's just, that's the way people roll. It just never used to be potentially lethal. Doing a rail of coke or something on the weekend didn't used to be so potentially lethal. So when we're talking about the drug war, it affects people who aren't daily opioid users like me, people who are just like casual weekend warriors, whatever. That's a big part of union members too. Like I've been to a fair amount of union gatherings where that's the case. And I think we got to look out for everybody. It may just be that a one-to-one person in the workplace, the best thing you could do is just give them simple advice about being safe, train them and give them naloxone. I think every workplace should have naloxone training and just teach people basics, like try not to use alone, try to test what you get. Do a little bit first. Naloxonetraining.com, I think is the Toward the Heart site where you can just learn it online. So you don't even have to show yourself to do anything. So I think the basic harm reduction that goes for any drug user could be communicated by a shop steward to a union member or by somebody at work to somebody else. Because for me, the concern is that the person doesn't die and doesn't get fired. If they're using drugs or whatever, no big deal. People always bring this one up, though. I'll close with this. Oh my God, you want a crane operator to be high on crack while they're moving big fucking pieces of I-beams and shit across the street? And it's just like, this is a bit of a spurious argument, but people bring it up all the time. Alcohol is legal, and we don't, we don't have generally crane operators who are drunk moving stuff. It's a high skilled profession. A lot of these high impact, high skilled professions are well regulated. If people care about crane accidents, then we need to regulate the assembly and disassembly of cranes, where more accidents tend to happen. So I just wanted to say that.
Thank you. We have a couple more questions, and I'm just realizing that we may not be able to get to both of them. We're going to need to. We're going to have a quick break soon. But Beta, there was a question from Harsha. I'm wondering if you wouldn't mind
For sure.
reading to the crowd.
Sure. So it says, thank you all. That was solid, and appreciate the clarity on the expansive vision for decrim with respect to policing and state power, and also bringing the fight to the shop floor. Can you speak more about how fighting the drug war locally is essential to anti-colonial struggles, given the disproportionate and intentional impacts on Indigenous peoples, for example, fatal overdoses, and anti-racist and anti-capitalist struggles broadly and globally? Thinking here to Bandu's important work on making links internationally, in brackets, the Philippines, and with Indigenous land defenders, etc. It would be great to hear more about that dimension of the struggle as it relates to a deeper understanding of the logic of criminalization and control.
I can try to attempt this question. I think the best way for folks on this call to support local harm reduction and drug policy is to support your local drug user group. So the Vancouver Area Network of Drug Users can't represent every drug user in this province, because what happens in Vancouver does not reflect what's happening in Quesnel, or doesn't reflect what's happening in Port Hardy, et cetera, et cetera. People are unique in every city and every place, and we need drug user groups across the province. Currently, we do have probably somewhere between 16 and 20 drug user groups that are forming. About 5 years ago, we would have said we only had about 5. So there's a huge movement of change in that, and it's really great. A big part of that that's needed is funding structures through our ministries of mental health and addiction, et cetera. But also locally, there's a lot of changes that are needed to municipal interactions with those drug user groups. Caitlin can speak to this more specifically, but a lot of places have this NIMBYism, which not in my backyard. It's usually a term that's put towards housing when housing structures are created in people's neighborhoods, but it's really focusing on drug user groups and OPSs currently. So for example, there was money given to have an OPS in Langley. I think 3 years ago they got the money, so an overdose prevention site. That site has still not opened because of municipal problems where they're either not allowing them to find a space, they won't give them a business license, et cetera, et cetera. And we see that quite regularly with drug user groups where they are able to find a space, and then they get things like WorkSafe coming every day. They have their business licenses reviewed and taken away. Their landlords are being basically harassed by the city. So at some point, the landlord decides to end the lease instead of extending it. So those are the things that would be helpful from my perspective, but I'm sure other people have other things.
I just think about when Harsha was asking the question, I thought about a couple of friends and comrades who aren't with us anymore. Tracy Morrison and Wade Crawford. Tracy was the president at the time of her death of the Western Aboriginal Harm Reduction Society. And that's a group within Vandu that fights to sort of connect the ideas of fighting colonization with harm reduction and the drug war. I mean, you kind of can't separate the drug war from white supremacy because that's how it started in Vancouver. You know, in 1907, there was a great fear, a great politics of exclusion and banishment, particularly aimed at like Chinese and Japanese migrants, and this big fear about, the proud white Canada is going to get diluted and there'll be no jobs and all of this stuff. So there was a big march on City Hall, which used to be right near where Vandu is. And that turned into a riot. And the march was organized by the Asiatic Exclusion League. And unfortunately, there were members of organized labor who were taking part in this. And so as labor activists, we kind of have a historic mandate to end the drug war because we did sadly play a small part in its beginning. So after this riot, a bunch of businesses were smashed up. The government sent a bureaucrat out here to compensate people. The bureaucrat noticed there was opium production and that it was affecting the white population. And there's a big fear of the Aryan Canada dream becoming infected by foreign influence and this sort of thing. And so very quickly, the Opium Act was passed in 1908, and that was really the beginning of prohibition in Canada. And ever since then, it's been used by police as a pretext to go lock up disproportionate amounts of Black and Indigenous people and people of color, get more often stopped and carded, arrested, charged, spend more time locked up, all of that stuff, and die from overdose. And so Tracy Morrison and Wade Crawford really were helping Vandu make the links to these kind of struggles, and very successfully. When Wade Crawford came to Vandu more than 10 years ago, he had the experience of fighting back home in Six Nations against condo development, and before that, being stationed on the Mercier Bridge during the Oka standoff, or whatever the hell it was called. Where the Canadian Army went and occupied the land of near Kanesatake that was going to be a golf course, or they wanted it to be. And that was like in 1991, I think. And so Wade helped connect the forces of the drug war and colonization amongst just rank and file Vandu activists. And so when people wanted to build a pipeline and the Wet'suwet'en were facing criminalization and the RCMP really cracking down in the last couple of years, Vandu people turned out to support and block the port, and do the kinds of activism that showed solidarity and just like a real understanding. And it's really baked into how Vandu organizes now, so we understand that the drug war isn't really just about drugs. It's about racism and white supremacy. It's about colonization, and not in an abstract way, in a real direct way that can be measured in the time that people spend alive, the lifespans of people, the time people spend locked up. All of these are quantifiable. All of this shows how the drug war falls harder on some people. And to me, it shows that if we're going to end white supremacy and colonization in Canada, you got to rip out the drug war. That's got to be part of it. As Desmond Cole says, the drug war is used to definitely fuck with Black people. But if it wasn't the drug war, it would be something else. So it doesn't end there, but it's definitely a big component of stopping white supremacy.
Wonderful. Thank you. Any final comments? I don't think we're going to get to, sorry, Bita, how are you feeling? I know you had more questions there. I'm just really, I'm conscious of time and that people have not had a break in a while, but what do you think?
For sure. I can at least read it out. So maybe if we don't get to it now, folks can discuss it in their small groups.
Great idea.
And that question was why are the youth, why won't the youth be protected? How and what can we do to protect them under decriminalization?
Oh, you know, the government, they're just like, oh, won't somebody please think of the children? Like, decriminalization is bad. We can't let the children have it. You know, there's always this sense amongst youth that they are, at least in policymakers' minds, uncorrupted and not yet ruined. The rest of us who are write-offs, yeah, fine, fuck you all, do what you want. But the kids, the children, I mean, I'm being a little glib, but really there is this sense. And if you talk to researchers like Danya Fast, who's worked a lot with young drug users, it's harder for them to get things that are like considered things for write-offs, like methadone and stuff like that. It's harder for them to get access to any kind of real meds that might do something, maybe Dilaudid, stuff like that. Anything that might reach a little towards like, oh man, you're a dope fiend. That's like the shining precious children don't get to have that. But we got to realize the kids use drugs. I mean, fucking A, everybody, I used drugs. I was a young drug user a million years ago. Everybody is. And if you look at the overdose fatalities, you know, kids are affected. Like, I mean, kids like 12 and 14 and stuff like that. So it's unconscionable. I think raising that that specter of the government leaving those people out is really important. And if you want to fight, I think Moms Stop the Harm is a good group to get involved with. If you're a parent or somebody who has a kid in their life, like that might help. But there's also Parents Advocating Collectively for Kin, which is a group that Hawkfeather is a part of. And there are some drug user organizations that have more youth involved than, say, Vandu, where the average age is, I don't know, getting up there, you know. But
I think the good thing to like talk about here is like, we don't know where we're going with the youth yet. They say that they're thinking about it, but as how to deal with it in the decrim context. I think though, people on this call, if you do see articles of like forced treatment on youth, etc., you start getting more involved with your political parties and telling them no. That was something that was brought up by the NDP about a year ago, where it was called Bill 22. Around the overdose crisis, where there were more youths having overdoses, but that's because the toxic supply is the way it is, where you can use drugs for the first time or the 20th time and still have an overdose. It's not related to someone needing to get into treatment specifically. It's more about the actual drugs themselves being not being tested or not knowing what's in them. So at the time they were saying they wanted to involuntarily put youth into treatment when they came in for an overdose. There's a ton of research out there that shows forcing people into treatment when they're not interested or not ready, or whichever term you want to use, is quite harmful and can actually lead to more overdoses when they get out of treatment, et cetera, et cetera. So I would just keep an eye out for those sorts of things, because I think when we think about youth, we're like, we need to stop them from experimenting, which is insane, because everyone on this call at some point experimented with something at some point. And so, you know, just remember that.
I think when it comes to the topic of youth, it's a little snapshot of how pervasive hatred of drug users are. And I think, honestly, on a very simple level, I think it's just harder for people to justify hating children. You know, we're a very othered group. And I honestly, for me, it often boils down to that. I think people just struggle to rationalize how they would treat youth with the same level of disdain they treat other drug users. I think that's a big part of it.
Thank you, Hawkfeather.
I add one last comment? Yeah, so one of the things that I think came out of participating on this core planning table for decriminalization was the power of police, and perhaps needing to make non-police involvement be a condition of participating in these kinds of processes in future, if we do participate at all. given the amount of sway they had and the fact that it overshadowed what other people were saying, there was a lot of discussion afterward among table participants about like really collectively saying, no, we're not going to participate if police are involved. The other piece that I took away was the need to have youth at the table as well. So youth are super often excluded from these conversations and conversations about drug policy and sex work because government does not want to, people don't want to believe that youth use drugs or youth do sex work or whatever. And so keeping them out of the conversation entirely is seen as the easier thing to do. But I've been asked by lots of youth who use drugs to in future say, if youth aren't at the table, then we're not taking part, or just bringing youth to the table and not asking for permission to do it, but they have to be there. And if they're not there, then undeniably we will continue to get policies like this that just outright deny any benefit of decrim to youth. So that was my takeaway. Thanks.
Thank you. So much depth. I'm really, really appreciative of our panelists who we'll get to talk to again in our small groups. My feeling is that we need a break. It's really hard to cut this conversation off because there's so much nuance. Let's take 5 minutes. I'm sorry, you're not going to get a luxurious break. We're going to have a quick break, and we're going to come back. We're going to get into our small groups, and we're going to really